Thank you very much to everybody for being today with us. Today is a very special day. It's 6th of April, and 6th of April is chosen by the Collegium Medicorum Theatri community to celebrate especially World Voice Day. As you know, World Voice Day in many countries exists since 2000, like in Mexico. We were talking and talking different specialists, and then at that time, with Johan Sonder, with Sten, with Mara Belao, and with Robert Satalov, and many other dear colleagues, we decided that we were going in conjunction with Mario from Portugal to make this movement of World Voice Day. And now we have almost 24 years. Every year we celebrate World Voice Day. So I'm happy that you have sent your proposals, your very nice presentations, and of course I also congratulate all the persons from all over the world that could join us today to hear the CoMeT members. The Medicorum Theatri is a collegium that we have 55 years, and the experts, scientists, physicians, speech pathologists, vocal coaching, and of course singing teachers that belong to this collegium where we discuss everything about artistic voice in a friendly situation. So we hope you enjoy that, and we begin with the presentation. I'm going to read only the names of my dear CoMeT members, colleagues. First of all, Austin King, our treasurer of CoMeT, and a very dear CoMeT member from Voice Institute of West Texas. Then Jakubu Karagama from United Kingdom. He apologizes because he sent his presentation, but he has some problems, he cannot join us, but he is delighted to answer questions to his presentation. Our dear Liza Popale from Los Angeles, United States, and also Antoine Joubin from Marseille. He's going to present a very interesting topic that you are going to enjoy. Then we have Eleonora Bruni from Italy. She's going to talk about what can we do with warm-up exercises. And our dear friend from Mendoza, Argentina, Ana Gloria Ortega, she is going also to give some tips, very interesting, about laryngeal repositioning. And Ilker Denizoglu, our dear friend from Izmir, Turkey, he is going to present a short video about vocal fold nodules before and after therapy. Our friend from Sao Paulo, Brazil, Dr. Reinaldo Yasaki, is also going to talk about preventive artistic medicine in professional artists. And our friend Alfonso Borragan, the president of Pan-European Voice Conference in Santander State, is also having a short presentation today. So let's enjoy. And our concept today is that you as panelists, CoMeT members, you can have later the discussion, and all the other invited audience can send to the chat all the questions or comments that they want us to discuss. This is our 19th CoMeT academic session, and I welcome you very much. And for all CoMeT members, please let me write your name on your small screen face. Thank you. We begin with this wonderful greeting and explanation from our friend Austin King, from our dear John Ashby, and our wonderful Mike Scarabo. They are going to talk about the approach of vocal dysfunction by Voice Institute of West Texas team.
On behalf of the Voice Institute of West Texas in the United States, I'd like to welcome you to World Voice Day, where we appreciate the complexities and the beauty of the human voice, and that is really probably underappreciated by us unless something goes wrong with that voice. And so today I'd like to tell you how we approach the vocal dysfunction of people utilizing the team approach of 3 different disciplines which all look at the voice in a somewhat different light. I'm Dr. Austin King. I'm a medical doctor, a laryngologist, and this is Dr. John Ashby on my right, and has a doctorate in speech pathology, and this is Dr. Scarborough on my left, and he has a doctorate in vocal pedagogy, or the science and art of singing. The human voice is so complex that there are multiple factors involved when it gets sick. And so it's the ability to identify those factors that can lead to treatment that helps us fix a sick voice. And as a laryngologist, what I do is put an instrument down through the nose and look directly at the larynx and try to identify what we call structural lesions, which may be polyps, nodules, irritation, even cancer, and also neurologic functions, which affect the function of the voice box, causing paralysis or tremors or spasms. And once I look at that, there can be other factors involved in how you use the voice box, such as nodules being caused by different ways of talking or singing. And so that's when we go to Dr. Ashby, and he will tell you a little bit about what he does as far as the diagnosis.
When a person comes in with a voice disorder, it usually involves some behavioral change. Somehow or another, the larynx and the muscles of the larynx are not coordinated the way they should be or where they could have been. So in voice therapy, we try to take a look at what has caused the issue that's there, which is otolaryngology, and in treatment, we try to adapt muscular functions, the synergistic functions of breathing and respiration, along with resonance and voice production to preserve or return the voice to normal.
And a lot of times they'll also be treating singers, and sometimes they're professional singers, sometimes what we call hobby singers. But regardless of the type of singing, it's important to them and to be able to sing up to their standards. And sometimes even singing will affect the speaking voice. And so that's when we return to Dr. Scarborough.
We see all kinds of singers. We see everything from what we term hobby singers. They do it just for the enjoyment of it. Church singers, musical theater singers, and we see everything to classically trained singers that have been trained. They've taken voice lessons for years and are accomplished singers. And of course, we have to address each one of those as they are suited to the need of the singing that they do. Whichever way you go, if they're just a church singer and they sing Sunday mornings, that is very important to them, and they want their voice to work. And of course, we can't give them the same kind of instruction that we would give a classically trained singer that has had voice lessons forever. We can still help get their voice to where it is in a suitable way for them to participate in the kind of singing that they want to do.
Thank you, Dr. Scarborough. I hope you understand some of the complexities involved in diagnosing vocal dysfunction in the sick voice, and the possibility of seeing 3 different specialties to help you out. But hopefully you'll never ever have to use this information. So happy World Voice Day. Thank you. On behalf
Thank you very much, dear Austin, and many dear greetings to John and Mike. And as you see, all over the world, there are these voice specialists in different areas, like medicine, like art, like science. And this is what is so important and unique by Collegium Medicorum Theatri. That's why we celebrate World Voice Day with all the world. And the next presenter is our dear friend Jacobo Carragama from the United Kingdom. He is going to talk about singer's dystonia. And welcome to Jacobo. And if you have some questions, please do not hesitate to write them in the chat. And I thank very much to Our dear Ron Scherer is also here, Ilse Denizoglu, Soledad Sachieri, they are also here now with us. Thank you.
Hello, thank you for the kind invitation to speak to you today on singers dystonia. My name is Yakubu Karagama. I am a consultant laryngologist at Guy's and St. Thomas's Hospital, Central London. Spasmodic dysphonia commonly affects the adductor muscles, and normally it affects the speaking voice. However, spasmodic dysphonia in singers is very rare and sometimes, or more often, misdiagnosed. I'd like to present to you a case of a patient who is in her 50s. It's a lady, it's an opera singer who presented with normal speaking voice, but however, her singing voice, she complained that her voice breaks and is strained as well and effortful to speak. So I'm going to play the video recording of her voice, indicating the areas that she struggled most, especially when she tried to go on the high pitch. You can hear the wobbly nature of the sound coming up from her vocal cords. You can see the contraction there, the ECA, LCA level of the larynx of the vocal cords as well. And the differential diagnosis for such presentation could be superior-laryngeal nerve palsy, or tremor, or spasmodic dysphonia. However, this patient's symptoms only present when she's singing at certain notes. She's had several speech therapy with no improvement. So I've discussed option of botulinum toxin A injection into the thyroarytenoid muscle, which I did under local anesthetic in the office. So I started with 1.5 units into each TA, and during her second visit, I went up to 2 units. But mainly, she is happy with 1.5 units in most occasions, on most occasions. There was one instance that I gave her 2 units on each side, but she had prolonged breathiness to her voice for about 4 weeks. So we've come to the conclusion for her at this point in time, 1.5 units is suitable. So this is the technique that I use. You can do this injection either by thyrohyoid approach or cracothyroid or transoral. You can also use an EMG to do this injection into the TA. I specifically chose to do with direct view because I want to be 100% sure that I am in the thyroarytenoid muscle. However, majority of my Botox injection into the TA I do on the EMG guidance, as most patients don't like the extra nasal endoscopy during the procedure. So this is the patient post-operatively. I'm just going to play.
Yeah. Moving around a bit on that. Yeah.
So this is the patient having some vocal therapy with my speech therapy.
The sun whose rays are all ablaze with everlasting.
And this is an audio feedback that the patient sent back to us post-injection.
Good morning. Good morning, Tori. I hope you can hear me. I just sending a little quick voice note just so you can hear that I think the Botox worked. Woohoo! So I'm keeping a bit of a journal. and I think we're going to catch up next week, hopefully. But I want to just send you a snapshot just to say this is where. So I had the injection on Tuesday, and I sent me above on Wednesday. I was just teaching, and I thought, oh, do we have a little try? Things felt a bit easier, a bit less treacly in the middle. And lo and behold, I didn't have that instability in my voice, and I could reach the little notes, which has always been the problem. I would never have been able to sing a song.
So you can hear that how she's happy with the outcome, and this is the voice.
The sun's rays are all ablaze with everlasting glory. Does not deny his majesty, but stands on fire before me. You will be called a blushing boy, a big childish Friday. So
in conclusion, singer's dystonia does exist. I think these cases are probably underdiagnosed. And if you look carefully, you may find that some patients that have been misdiagnosed as functional or superior laryngeal palsy, or just saying nervousness, maybe spasmodic dysphonia that is affecting just the singing voice. I think it's worth trying the Botox because the side effect for Botox is usually reversible. And if it works, then it's brilliant for the patient. If it doesn't work, then at least you know you've excluded that as the cause of the patient dystonia. Thank you very much.
Thank you very much, Jacobo. And there are some questions for you, so I'll let them know in the next session that you are going to be here, because this is a very interesting topic. Reynaldo asked something, but we shall discuss that when you are here and I send you the questions. Please, for the panelists, I give a big kiss and welcome to Professor Jürgen Wendler. And if you can please change to the other link. If not, please stay with the general as you wish. And the CoMeT members who are panelists and they do not have their names written, please let me know your faces so I can write the name, because now I am writing the name. And I welcome our dear Antoine Giovanni from Marseille with this very interesting topic, vocal folds carrying and aging and regenerative medicine. Great, Antoine. Thank you.
Dear colleagues, my name is Antoine Giovanni, and I work and live in Marseille, in the south of France. Today, my talk will deal with the perspectives of regenerative medicine in the field of vocal fold scarring and or vocal fold aging. In this presbylarynx, there is as well an atrophy of the epithelium and or vocal muscle, and a rigidity due to the modification of collagen fibers in the rhynchus space. And watch the video. The question today is therefore to propose a treatment targeted on what we can know of the physiopathology. Basically, there are two main directions. The first is to treat the lack of tissue by modeling injections in the vocal fold. Most of the time, as in many other tissues, the solution can come from hyaluronic acid or fat tissue. It's really easy to perform in the vocal fold thanks to the new fibroscope with operating channels. But modeling injections or even prostheses cannot improve the pliability of the rhynchus space and or vocal ligament. That's why we decided to watch if there was a therapeutic option in the field of regenerative medicine. In our group, thanks to the vicinity of the cellular therapy lab of Professor Sabatier and Jeremy Magalon, we decided to put our efforts mainly on two types of products. Stromal vascular fraction, mainly for severe vocal fold scares, and PRP, mainly for presbyphony. The stromal vascular fraction is produced from adipose tissue harvested during the same procedure. There is no step of cellular culture. The very first case published in the world about vascular stromal fraction in vocal folds was a 40-year-old woman who had a severe dysphonia associated with scared vocal folds after a phonosurgery for larynx edema. Here is a videolaryngoscopy before the injection. We can see an absence of vibration in the middle third, and we can hear a hoarse and stable voice. After 1 year after injection, the vibration of the middle third is improved and the voice is less hoarse and more stable. The objective vocal assessment was greatly improved, including the voice handicap index, which decreased from 75 to 9. Here are shown the global result of CellCord trial that was a phase 1 trial on 8 patients. Videolaryngoscopy showed a major improvement of vibration in 4 patients and a significant improvement in 2 more. As previously told, we use as well platelet-rich plasma, mainly in 2 indications. The first indication are vocal fold scares not includable in the CellCord trial, for instance, because the patients are reluctant to the idea of placebo. The other major indication are dysphonia and presbylarynx. PRP is obtained by simple centrifugation of anticoagulated blood. The blood elements, erythrocytes, leukocytes, and platelets, are separated from the plasma, given their difference in density. PRP is obtained by keeping the plasma and platelets, which have the lowest density. There are more than 1,000 different proteins contained in platelets, on the surface or in the platelets, making them a huge reservoir of bioactive molecules. That is easy, fast, and safe. In the absence of nucleated cells, its use is simplified from a medical legal point of view. Peku in New York has obtained good results in scared vocal folds with repeated office-based platelet-rich. Peku had obtained good results in scared vocal folds with repeated office-based platelet-rich plasma injection, improvement of the voice handicap index, but also acoustic and stroboscopic tests. In our center, we tried PRP on 49 patients with 1, 2, or 3 injections with a 1-month interval. Globally speaking, we observed around 66% of improvement or significant improvement on the stroboscopic vibration. Here is a video showing the procedure that is performed entirely under local anesthesia in an outpatient procedure.
Un prélèvement au pli du coude en asepsie. Ensuite, on récupère donc 18 ml de sang qu'on va transférer dans un dispositif médical que l'on va faire centrifuger. Une fois la centrifugation terminée, on récupère le plasma et que l'on transfère dans les 2 seringues donc de 2 ml. Toutes ces étapes sont réalisées sous un PSM, donc sous un poste de sécurité microbiologique pour bien assurer la stérilité du produit.
Sous anesthésie locale, dans le cadre d'une hospitalisation de jour.
Il va rentrer dans une salle qui est dédiée, on va endormir ses fosses nasales, puis on va, à l'aide d'un vidéo-endoscope, arriver au niveau du larynx, anesthésier également le larynx, et à l'aide d'une petite aiguille insérée dans le vidéo-endoscope, le plasma riche en plaquettes va pouvoir être injecté directement dans les cordes vocales, 1 ou 2 cordes vocales, en fonction de l'indication. Après cette injection, le patient reste en surveillance pendant environ 1 heure, le temps que se dissipent les effets de l'anesthésie, puis il pourra regagner son domicile le jour.
Here is a clinical case of a patient suffering from a presbylarynx with a severe breathy voice before and after a series of PRP injections.
C'est souvent le matin, quelquefois dans la journée. Je deviens aphone, un petit peu comme j'ai là, mais beaucoup plus Il n'y a pas grand-chose qui sort.
Essayez de faire ah le plus longtemps possible.
Ah.
Parfait. Et très bien, un peu plus fort. Et encore. Et encore. Ouais.
Lundi, mardi, mercredi, jeudi, vendredi, samedi, dimanche, et on recommence.
D'accord. Finally, in the future, we have to combine regenerative medicine and medialization procedures to take into account all the different aspects of scars and presbyphonia. Hope tissue engineering will give us new tools combining the best of the two procedures. Many thanks to the group of Marseille, and thank you for your attention.
So, dear friends, this is great, Antoine. This is a really very interesting topic, and I am very glad that you could present us this, because this is a way to being all together. A very great welcome to our Johan Sundberg. I'm very happy that he's here. So also there are many friends in the as assistants. Ilse cannot come to the panelists, but there is still one panelist who I don't know who is, and please let me see your faces. Now I am going to make a short presentation about when to perform polyp surgery. It is very well known from all the CoMeT members, but because it is an open session, I would like to show my video. Thank you. Hello, everybody. I hope you are enjoying the different activities from the World Voice Day celebrations, mainly today in Collegium Medicorum Theatri session. I will talk about when to perform polyp surgery. And this is important to understand that we have sometimes many difficulties to sing or to speak when we have this kind of structures. Thus, as we know, there are benign tumors that are avoiding that you have a proper function when you are speaking, or when you are singing, or when you are performing in general. So I will share with you this screen to look at different small cases, like for example, this case that we have a keratosic polyp. We can also have hemorrhagic polyp or sessile, and this is mainly the epithelium and the subepithelial space that are with damage during these problems with polyps. As we know, these polyps avoid a complete proper function of the vocal folds, and that's why sometimes we need to make the surgery. As you know, sometimes with correct voice therapy and correct medical treatment, you can avoid to have a surgery. So the signs are different and the symptoms are also different. That means that due to the phonotrauma that you are having, you can have dysphonia, very slight one, or a very heavy dysphonia, phonosthenia. Your pitch range can be limited, mainly in the high pitches. You can also experience vocal fatigue, periods of aphonia, or during speaking or during singing. Instability also, harshness, cough. Sometimes you need to clear your throat. And sometimes when you're a singer or an actor or a conductor, you need to have longer warm-up routines. Sometimes when it is a long time polyp, you can also experience pain by speaking or by singing. Also about these signs, you can also have signs and symptoms due to different problems during performing. And this is mainly overuse or misuse. It can be in volume, it can be in the way of function of you have the function of your voice, like shouting, coughing, talking. You can have long periods using speaking or singing voice, mainly if you have noisy environments. You can strain your voice, you can scream, and sometimes you misuse high tones or low tones, and this can give you many problems like you see here. There are factors that worsen these polyps, like smoking, alcohol drinking, allergies, mainly in respiratory superior airways, thyroid changes, chronic reflux, irritating food or beverage, and also using your voice with upper respiratory inflammation or infection. And the artistic voice performers that do not warm up properly, or do not cool down properly, or use the voice in noisy environments, or have a wrong repertoire, they can also have this kind of problems as you see here in this endoscopy. So if we have this kind of lesions, we have to take care and treat the allergies and asthma, but sometimes the patient themselves, they do not take care about this. It is important to have vaccinations against infections, viral infections like influenza or coronavirus, or bacterial like pneumococcal, streptococcus, staphylococcal, and also papilloma virus and herpes virus. The self-medication is not a good idea for this kind of patients. Either allopathic, homeopathic, naturist, or alternative, you have to be careful. Do not be late to an examination if you have some symptoms in your voice. It's important, and that's the World Voice Day message. Please take care of your voice. Please be so nice to your voice as possible. So you need to go to a phoniatrician. This is medical doctor with expertise in voice, or an ENT with this kind of expertise. It is important that you do not avoid voice rehabilitation when you need it, and of course, singing lessons or vocal coaching, even though you are a professional, because sometimes you need to have a proper function, and that's why it is important to have this vocal coaching and of course singing lessons in order to avoid more problems and to get all your vocal functions again in a proper way. Before surgery, it is important to avoid having inflammation of the vocal folds of the larynx, to treat esophageal reflux, to control the respiratory allergies, and control the lower airways. For example, here in these long COVID problems in this scanner, you have to take care about that. And to go to a surgery under the most most control of all the different issues that you can have. If you have disturbance of the glottal closure, disturbance of the mucosal wave due to the polyp, and due to the activities or agenda, you cannot make the surgery or you need to make the surgery urgently, it is important to talk that to your doctor. And of course, to see the time of evolution, because there are many polyps that can be treated by medical treatment with the voice rest, of course, voice therapy, and of course, medicines. For example, in these patients, you know exactly that the mucosal wave is not so bad, but anyway, the disturbance of the glottal closure is very important. When we make indirect endoscopical phonosurgery, this is the ideal mainly in artistic voice, because you can have the patient awake and the patient can make different voices like E or E, and you have the function. And if you have the function under stroboscopy during the surgery, it's a great help to decide what kind of approach do you need or what do you need to make better. As you see here, the patient is in a sitting position and the screen above the head allows us to see all the details like you will see in this other endoscopy with the surgery. So you cut the polyp and then you go to the tiny details under stroboscopical light, and of course the patient can sing, can make high tones or low tones. And this indirect endoscopical phonosurgery is very important for these patients. These patients need to avoid as much as possible frequent respiratory diseases. If they need another kind of surgery, it has to be done in a proper way. They have to take care of the airway hypersensitivity, avoid passive smoking, taking care of bad eating habits, and of course the emotional factors. In the house, they need to take care of the chemicals that you are using for cleaning, and on the stage, the smoke or dust in closed area are not a good idea. The food chemicals are also important, and of course, a proper ventilation that you can have all the particles of the saliva away. We do allergy testing in blood, respiratory, and food. We avoid tobacco smokers, also passive. We make rotatory diet if it is needed, and avoid chemical overload. Voice therapy is compulsory before surgery in order to look at breathing, resonance, and glottal closure, and after surgery depending on the vocal function and the activities of the patient. I thank you very much for your attention. I wish you celebrate all over the world with our virtual and also face-to-face activities of Collegium Medicorum Theatri. We shall have our annual conference during the World Voice Day month, and I hope you have a very nice day and many greetings from Mexico City, city of volcanoes. Thank you very much for your attention.
Thank you very much. And I would like to thank also our dear Alfonso Borragan. As you know, he's a professor, otolaryngologist, phoniatrician in Santander, Spain, and he is the actual president of the Pan-European Vocal Conference that's going to be in Santander, Spain, and CoMeT is going to have a session there. So we shall hear about this very interesting approach, voice, nose, and gut, connected through the tissue that we know belongs to the lymphoid tissue. Thank you, Alfonso.
I am Alfonso Borragán. I am a phonetician, and today I am speaking about voice and nose and gut connected through the mold. The immune system constantly monitors the entry of foreign and potentially dangerous organisms. It also monitors the transformations of cells into malignant or aggressive ones. The immune system is a very effective police force. A very important part of the immune system is mold, mucosa-associated lymphoid tissue. Mold is a concentration of lymphoid tissue in the mucous membranes. It is located diffusely at the entrance door to the body, intestine, upper respiratory tract, lung, genitourinary system, conjunctiva. The mold in the upper respiratory tract is inside the Waldeyer rings. This Waldeyer ring is formed by the palatine tonsils, pharyngeal tonsils or adenoid, lingual tonsils, lymphoid follicles of the pharyngeal walls, and laryngeal tonsil. A local infection or inflammation will produce major changes in all tissues. In this case, we can see grade 2 out of 3 adenoid hypertrophy with mucus that is clear when speaking.
Para salir.
We can also see the inability to open the eustachian tube. The results in abnormal vocal fold dynamics. The free edge of the vocal fold is possible due to the inflammatory factors. Glottic insufficiency and double gap. Mucus and scant mucosal waves. Any immunological reaction affects the function of the upper respiratory tract, altering both hydration and the movement of structures in swallowing, speech, and phonation. In the glottic space, laminitis of the free edge of the lamina propria, microulcers in the epithelia, mucosal adhesions of lamina propria occur. And at the symptomatological level, fatigue, vocal fatigue, paresthesias, dysphonia, discomfort, and pain appear. There is an interaction between the different mold tissues and therefore adenoiditis, rhinitis, tonsillitis, asthma, allergy, food intolerance, or a urinary infection can all cause vocal fatigue, throat clearing, or dysphonia. The best therapy is to seek to improve lymphatic flow with lymphatic massage while talking or singing. Breathe with your diaphragm, do gentle exercise, walk in water, take hot and cold showers, and at the same time speak or sing without tension, without effort. The fact that upper respiratory tract belongs to the immune systems makes the larynx fragile and generates chronic recurrent inflammation because anything can attack it. But the voice its function can also serve as a good stimulant of the immune system. I would like take this opportunity to invite you to the upcoming PVOC 15, which we will be holding in Santander, Spain, from September 4 to 7, 2024. It will be full of life experiences and magnificent scientific lectures and artistic performances by the speakers and singers who will be attending. Thank you very much.
Thank you very much, dear Alfonso. Unfortunately, Alfonso cannot be with us today because he's somewhere giving courses, but I have all your questions, and of course, we shall discuss that if possible today, but with Alfonso and with Jacobo next session. And I would like to say hello to our dear Alan Burma and to queridísima Iris Rodriguez from Argentina. Thank you. And also to the assistants, Teopilcin, Tiago, Rosa Maria, Tumanta, and of course, Maria Isabella, and many of our friends, Liliana, Rafaela, Harmut. So I thank you, Aida, Elisabetta, to be here. And I would like to ask our dear Ilter Denitoglu to talk, he's talking now, to give us a very short introduction about the images that we are going to look at, because usually Ilter was not going to be here with us because of flights and problems, but fortunately he is here with us. Yes, Ilter, microphone is yours.
Thank you very much. And I would like to congratulate the World Voice Day for every CoMeT member. So can we start video, or can I share my PPT?
Yes, we can see the video first.
Okay. I mean, the video is in the PPT, but it's okay. Or if you wish, we can do only video.
Okay.
So in this video, as you can see, there are both-sided vocal fold nodules.
Sınıf öğretmeni
Can you pause?
ses kısıklığı yaşıyorum.
Perfect.
Dinlenince biraz geçiyor gibi ama tekrar oluyor.
Yes, perfect. So you can hear her voice. It's a very breathy and rough voice. In our clinical practice, we do not look at the vocal folds. We do not look at the nodules because it doesn't show the movement. It doesn't show the fourth dimension of anatomy, which is movement, motion. So we must look at the dark side. The dark side here is the glottis, the space between two vocal folds. But the tissue, the white things, they must show us the vector analysis of the muscles. Can you continue the video, please?
Bir, 2, 3, 4, 5, 6, 7, 8, 9, 10.
8 weeks later, we made voice therapy. In our clinic, we use the Dr. Vox voice therapy, and the closure pattern of the glottis by changing the vectors. Can you stop the video?
Kendi sesimden memnunum artık. Eskiden konuşmak içimden gelmezken çok büyük gelişme kaydettiğimi düşünüyorum. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
So at this very short presentation, I would like to tell you that the voice is muscle, and we need to know muscles to change the vocal closure pattern which starts from the intrinsic muscles, goes to the extrinsic laryngeal muscles, and goes to the whole body as the vocal instrument. Again, I would like to wish you a very happy Voice Day and the whole voice month in this way, because the whole month, April, is going on with many, many occasions like we do now. Thank you very much, Eugenia.
Thank you, Ilse. So you have now the commitment and homework that in August that we are celebrating 55 years old of Collegium Medicorum Theatri. You will talk about muscles. So
yes.
Now other homework. Thank you.
Okay, thank you.
For this proposal. And as you see, my dear friends, we are a community that we are dealing with very fine function of the human voice, and this is the artistic voice. So now we are going to hear, it's a little bit long, the preventive artistic medicine for professional artists from Reynaldo. And thank you, Reynaldo. And can we please move on with the video?
Hi, how are you? This is Reynaldo Yazaki, and I'm a laryngologist specialist in ENT and phoniatrician who is also a phonosurgeon for singers here in São Paulo, Brazil. And I'm very delighted to contribute in this wonderful meeting that is organized by the Collegium Medicorum Theatri. And I'd like to tell you that I'm proud and I'm happy, and I have been proud for 7 years that I'm with you, that are very specialists, very special and good, experienced surgeons and physicians and professional voice carers from all around the world. The theme I will lecture today is about preventive medicine in the artistic voice, and I will share my presentation right now. Well, preventive artistic medicine for professional artists. Prevention. Why prevention in the artistic voice? Because the show must occur, not always go on, but also occur. It's an attempt to avoid worse body or vocal scenarios that could impede the main presentation or show. Let's always remember that when an artist has got very light or mild laryngitis or chorditis, it is feasibly possible for the show to occur. Whereas it's not possible to rehearse with moderate or severe laryngitis chorditis. Why? Because they cannot achieve the high tones, because their passages will be compromised, because their voices will not have the power or punch they are used to use. And of course, when they try to use this voice over a moderate or severe chorditis or laryngitis, there is a very possible risk and high risk of acute cords injury, which could remove the artist from the next presentations in the 7 or 10 days. Also, prevention will show measures to teach the professional artist to take care of his or her health, not just the voice, but also the body. Teach them to look for help before it is too late, before the mild laryngitis become a severe laryngitis before a slight edema become a nodule or a bigger edema. Teach them also to look for specialists with a good timing, and those specialists must be very experienced in laryngology or phoniatrics dedicated to the artistic voice. It's not just being a specialist in laryngology, but also being a specialist and experienced with professional artists. And why do I do say that? Because the artistic voice is a very specific niche in our fields. And the singing voice is a smaller niche inside a very small niche that is the artistic voice. So it's not every laryngologist or phoniatrician who has got the sufficient and necessary experience to treat that patient. Also, teach them the importance of a good image, a good endoscopical examination, possibly with the same attending specialist for us not to lose time. We have to do the diagnosis in the same day, because sometimes they come in the day, on the day of the presentation. And this is a very, very dramatic scenario. So another attempt is to teach them to look for us before it is too late. And in the day, on the day of the presentation, in great part of the times, it is too late. Well, we have here around 20 years of practice, private practice. And I've seen around 15 to 18 patients every day. Most of them are artists. And in 20 years, around 6,000 patients and around more than 900 surgeries, nasal, tonsil surgeries, and voice surgeries in singers. But what are the measures for the preventive medicine in artists? One of the most important items I had to tell you, I want you to take home message, is the experience in upper airways infections and their evolution with or without treatment. It's very important for us to maintain proximity and easy mutual messaging between physician and patient and artist. Why? To come, diagnose, and treat the earliest possible. Also in the weekends. But why in the weekends? Because the artists, they work through Thursday to Sunday, most of the times. And always when they first reach us, ask when is the main presentation, because with this response and answer, we will have in our mind the timing we have to reach the best voice possible for that presentation during the Oscar or during the Grammy for billions to watch it. That's why it is important for us to keep in touch through CoMeT, because we have to have specialists and partners around the world. For example, Eugenia is a great part of me in city of Mexico City. And I referred one patient of mine who is Aladdin in Mexico City 2 weeks ago. And he was pleased to be treated by her, and he got better after that, after her treatment. Importance also in having and buying and investing in good cameras. We are in the era of technology. We are in the era of artificial intelligence. So we have to try to be better than everything through using the technology in our favor. For example, using good images, HD, Full HD, and also 4K. Why? Because singers and artists in general don't have bigger lesions. They have very subtle micro signs or microedemas that disturb the way they are used to sing, the way they are used to perform. And always, when an artist comes to you and to me, I always perform a full examination because there are hidden signs and diseases in the nose. So I perform video nasal and stroboscopy. Never look just the vocal cords. Never do that. You will miss 30 or 40% of the diagnosis that lead to a vocal problem, a vocal difficulty. When you think about prevention, we have to remember that singers and artists, they rely on their ears to sing or to speak. So an annual audiometric screening it's very important and used for those ones who live on stages, the use of in-ear feedback phones, because when you hear yourself well, you can use an economic voice that can make this voice endure more time during the week, the month, or the tour. As we know that the main pitfalls of every artist is in an upper airway infection, we have to focus in increasing their immunity through vitamins, D, C, zinc. I use oral bacterial vaccines for those ones who have been bacterial sick in the last months. I use pneumo 13 or 23. I use the vaccine for flu. I recommend corona vaccination and a good lifestyle with good food, good rest, with sleep. I treat sleep apnea. I treat snoring. I become a general physician, general practitioner, because everything can impact in health, and if the health is not okay, the voice can also be disturbed. I use also the prevention and early treatment of reflux, allergy, the enteroviruses, because these three conditions also can impact in body energy and the voice. And another thing that I really like to do is, as I told you, in general, singers and artists have subtle micro signs in the free edges of the vocal cords. So it's not a big disease, but it brings them difficulties. And sometimes there are not subtle micro signs, but there are signs that show that the high tones are not being produced in a good manner. It's not just about what we hear or listen to. It's about what we see during the nasal video laryngoscopical examination. And for example, if I see that in F4, 350 hertz, or F5, 700 hertz, there is no enough vocal fold elongation. I know that there is the need to develop a better or bigger elongation of the two vocal folds during the performance of this high tone. So this is something that can be addressed and treated by a customized voice therapy with logopedists or voice therapists. I call it preventive voice therapy to treat the slight handicaps. There are around 6 to 10 handicaps that can be treated. And I'd like to say thank you for your attention. This is my email. This is my WhatsApp number. This is my my Instagram, and this is my Facebook. We'll be in touch in the next minute to talk about doubts and answers. Thank you.
Thank you very much, Reynaldo. So as we know, the concept of today's session is to talk to the general population through our experience and knowledge about artistic voice. So thank you, Reynaldo. And we keep on with our today's session. And I would like to say hello to our dear friend, Filipa. Mwah. Great that you are here with us, Filipa from Portugal. Okay, so keep on with the presentations. We have still very interesting presentations, but please do not go away. It's great to hear you all together. So this is 3 belting exercises from our dear Liza Popale. She unfortunately cannot be with us, but she has sent this video. Thank you.
Though belting is usually thought to always be loud and resonant, the best way to experience belting as a beginner is as an extension of speech. That means singers need to be able to take M1 or chest voice up to high pitches comfortably, reliably, and at different volumes, including at high volume. To be able to belt safely and even beautifully, correct posture and support are vital. In this short presentation, I'd like to share 3 of my favorite belting exercises with you. The most important preparatory elements for belting are that the sternum is lifted as if it's resting on a hook. The rib cage should be comfortably wide and the back of the neck should be long. When singing, the upper belly magic spot, also known as the epigastrium, should firm outwards for singing, not in. Inadequate support tends to result in undesirable tensions such as squeezing, choking, head twisting, and having blood vessels pop out of your neck. Belting, meaning singing high in M1, requires more subglottal pressure than singing in head voice or M2. Lastly, to prepare, singers should initiate the belter's bite. Face lifts up slightly with the masseter muscle engaged, and that will protrude the chin slightly. The first belting exercise I'd like to share with you is the M1 siren on the vowel ah, like this. Ah! It's important to practice this at a medium volume and to not get louder just because the pitch is rising. Singers should make sure that the vocal fold can thin gradually in order to make this sound on high pitches. To help thin the vocal fold without changing registers, I use this gesture, the thumb pushback, which helps raise pitch without raising the larynx excessively. Ah! The second category of belting exercises are the pressure sounds. My favorite consonant for this purpose is the B sound, the B sound. This B sound creates a sense of breath holding, or the feeling that you're holding back on your breath to produce a solid, clear, but unpressed M1 sound. Once a singer can make these sounds at a medium volume, then we move on to the pattern 1-3-5-5-3-1, like this. Beep, 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 beep. Beep, 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 beep. Sometimes singers need to use a maneuver I call the sippy breath first, prior to making these sounds. The sippy breath looks like this. Beep, 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 beep. Beep, 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 beep. Interestingly, M1 exhibits a clapping pattern in the vocal folds, and these pressure sound exercises create not only a high degree of subglottal pressure, but also back pressure from the lips, which helps the vocal folds clap without squeezing too much. The third category of belting exercises today are the calls. The beauty of the calls is that they get us in touch with the natural calling we do when we were children. This is very important for classically trained female singers who might subconsciously equate high notes with head voice. Posture, support, and breath holding are all key to producing these sounds in a safe and controlled way when beginning to learn to belt. No! Come over here! Go over there! How you doing? I'm doing great! Come here, Mommy! Come here, Daddy! Come here, baby! You may have noticed that I removed the H sounds. For beginners, the H sounds, like in the word here, can impede the constant clapping action required of high M1. For advanced belters, belting with H sounds are no problem. Hey, 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 hey! The calls are really fun and help singers be less fearful of belting. I like to say that if one feels a tickle, a desire to cough, a burning sensation, then it's wrong. Otherwise, it's probably right. There are other valuable belting approaches in the commercial voice pedagogy world, but for beginners, these three belting exercises, the sirens, the pressure sounds, and the calls, are very safe and are an attractive introduction to a solid belting technique.
Thank you very much, dear Liza. Always a great pleasure to see the result of all the professions together in the optimizing the singing voice. Thank you, Liza. And now we go to the next presenter, and we are almost finishing. Wait a little bit, two more surprises. More than just a word, I think, Hector, I think Ana Gloria is first. Ana Gloria Ortega, yes. She's talking also a short video about exercises of laryngeal repositioning. Thank you. Sound. Well, dear friends, as you see, this is having
Greetings from Argentina on World Voice Day. Today, I would like to share with you 3 tips related to laryngeal repositioning. The larynx plays a vital role in various functions, such as swallowing, breathing, phonation, effort, maneuver, and protection of the respiratory tree. It is also connected to our emotions. When we feel nervous or unsafe about our survival, the larynx reacts by protecting us. It rises and moves forward. Similarly, when we speak in loud voice or talk excessively, our larynx can become tired and strained. To produce sound, the larynx should be in a neutral or down position in the neck. Here are 3 tips to help you reposition your larynx. The first one, put the tip of your tongue at the back of the soft palate and exhale through your mouth, this way. This will cause your larynx to descend in your neck. The second tip, blow air through your mouth with one finger on your lips. This will also help your larynx descend.
The video is stopping, Hector. Some technical issues, Hector. So these tips, which are we were in the second tip, dear Ana Gloria. So Hector,
I show you.
No, I prefer the video because it's very well structured, and I thank you, my dear.
Yes.
Anyway, we shall see with Hector. Is something wrong with the video? Hector? Okay, Ana Gloria, so please show us.
Yes, that tip is this way. And the last tip is called fish technique, and it is this way. This way the larynx moves upward and downward. I hope these tips are well for you.
Thank you very much, dear. Hector, did you solve the problem, or I keep on with my presentation of general issues? Because we are still missing Eleonora.
We can start the video all over again. I don't know where it was before.
Okay. It was in the second exercise. If you please put a little bit. Yes, there.
There is a ghost. I hope these tips are helpful for you.
Thank you, dear Ana Gloria. Anyway, dear friends, oh, it's over there again. Okay. Wonderful neck do you have, Ana Gloria. Thank you for talking about this important issue. Can you please put sound, Hector? Well, anyway, friends, we shall let the video in a proper way shown in our YouTube. And do you have the next one, please? Is our last presentation. Is more than just a vocal warm-up, how to improve and train the voice by preparing for singing performance with our dear Eleonora Bruni from Italy. Thank you, Eleonora. And I hope this video runs properly, and this is the last video. We have very heavy videos today.
Good evening to all the CoMeT colleagues, and thank to Eugenia for the invitation and for the wonderful work also, and good voice day to us all. This short presentation will demonstrate a special type of very short and focused vocal preparation that preceded the performance, achieving both an effective warm-up and increase in technical vocal skills, so that the results are established over the time and easy also to recall during the performance. We combine preparation for the musical event and for technical growth of the voice. We show the work done with a well-known Italian artist who is facing a long and very demanding studio tours. The artist is regularly followed by me as a vocal coach during the tour, and also by Marco Fantini, also our friend and member of CoMeT, as a phoniatrician, with a regular checkup, stroboscopy, and other instrumental examination. A very extensive monitoring of this great artist carried out by myself and Marco Fantini is now in progress, and we are working on this artist. So our artist performance schedule is very demanding. Many concerts, often with tight schedules, thousands of people singing through the concert, a voice that uses a wide tonal range, mainly in mechanism 1 with rare 4 ways into mechanism 2 and falsetto, with a great belt presence. The performer has a very present full voice, so chest, mechanism 1, belt, often with clear timbre and high emission at a rather high larynx. The songs are written to go up in both dynamics and pitch. The singer also often plays the piano while singing, has a hyperextension of the neck with bregma alignment, sometimes complains of a vocal fatigue, tired and detuned voice. His vocal folds are healthy, and he has a tonic and muscular temperament, but he has a little elasticity and often a lack of hydration. We show now some instrumental studies, spectrum and electroglottogram, before a short session of specific exercise. Okay, now let's go to the exercise, to our session. The exercise are arpeggio with a major chord, repeated 3 times with an airy This is important to improve airflow vectoring, to use legato, to reduce glottal resistance, and to activate sostegno and appoggio. Then we have an arpeggio with lui. It's very useful to improve articulation, encourage balance of laryngeal movement, and to encourage the tilt of the thyroid cartilage. Then we go to the upper part of the full range, high notes, with lightening, because we want to encourage the preparation for mechanism passage. Then we have an arpeggio with is a soft exercise to increase resonance and vocal tract space management and to improve also the soft palate mobility. Then we go to the high notes to promote the transition and uniformity between mechanisms and to reduce the resistance and the constriction. Then we have a descending exercise with the emitting it behind the lowest notes, in release, in relax, to have a thyroarytenoid muscle tonicity and vocal tightness also. Then we have an exercise with a very, very small this is useful to promote a gentle adduction and elasticity, stimulating the work of the tongue and of the soft palate. And then at least we have an exercise I call the cage, in which we articulate inside the mouth by closing the lips with the finger, like this. Closing my mouth. Then arpeggio with Louis. High notes. Then we go to the R. High notes. Now we have this in relax. And then we go to the ng. So small, so small. And then the cage. Let us look at the examination before and after the exercise. And now, after the warm-up, after the exercise, and we try also a high pitch. Now we can have a look before and after, and we can see how the work affects the richness of the sounds, reducing vocal fatigue and constriction, and it improves the harmonics also and their placement, especially in the upper part of the spectrum. Now we can work with this artist, and the breath is more free, support and what we call sostegno and appoggio is activated in a natural way. The larynx tends to be in a better balance. The management of the vocal folds improves so much that the singer feels that the pitch is lower. So instrumental examination before and after the exercise show that the voice is not only warmer and more ready, but also more capable of handling the main pillars of the technique: breath, larynx, and resonance. So thank you all, and again, happy Voice Day. Let's celebrate in our works and also in our lives. Thank you very much.
Thank you very much, Eleonora. And I thank you, all of you, because this has been a wonderful experience. And I would like very shortly, as short as I can, first of all, to thank all these speakers today because they made a great effort, because as we know, they have the daily commitments in clinics or in studios or in traveling and giving his knowledge, her knowledge and experiences all over the world, but also because this month is a crowded month because of our World Voice Day. This is the voice for the mankind and for our world. So thank you very much, all of you who made this effort. And as you have seen, I am not the best in sharing screen, but well, I think I have to learn more and more and practice more and more. So I would like to tell you about the last news. Let me tell you the last news of our activities, because as you know, the opera of Paris, La Bastille, due to the very close friendship and attendance of our friend Erky Bianco, they accepted to support, I don't know what happened, to support us, and we are having our annual conference in this great place that it is the Opera La Bastille. And as you know, if you allow that, we shall have all these sessions in YouTube. Please do not forget subscribe. A subscription in YouTube channel of CoMeT is free, and I think it's a great situation to have this YouTube channel. So we need to work with this new technology, because has given us until now 19 online sessions. So we are having in this annual conference that everybody is invited. Please think about that with your pillows, and perhaps you can take a flight directly to Paris, enjoy the annual conference. Because as you know, CoMeT is not only academical activities, but in a family, in the social activities and cultural activities, we share many things that are important for CoMeT development and for CoMeT support to the world. So we are having this, after wine, we are having this performance, Theatre de la Ville, where Erky found it interesting because it's joining theater, singing, and dance. With this is a Canadian proposal from these authors, and this is a great activity to have all these performances together. This is on 17 April. 18 April, we go to Opera Studio Bastille. As you know, this is a modern building, and we are going to have this wonderful conference room that Erky Bianco organized for us. And then we have, of course, the program. The program is very interesting. As we know, CoMeT, as you have seen today, is a lot of different professions, but all together working for a better understanding and a better treating of the artistic voice. So we have different confirmed speakers. Of course, is Alan Burma there, is Philippe Ilter, is Carles Exposito, Camille Fink, that is the new CoMeT member, Dirk Muir, Catherine Newman, Liza Popale, Roman Peruz, and Brigitte Boissard. And we have different presentations, and the main lecture is a guest from Erky Bianco. This is Professor Christine Petit. She is going to speak about special music in the brain. She is the head of the Auditory Therapies Innovation Laboratory at the Hearing Institute in Institut Pasteur in Paris. And we shall have 3 very interesting roundtables. And of course, as you see here, our Erky with his presentation and his curriculum. And you can see that. And we are going to try to also have this in a recording,
so we can share that after the Congress with everybody who could not come to the Congress. On Thursday, 18, we have a special visit at Opera Bastille. And then after lunch, dinners, coffee breaks, and all science, we shall have on Friday after our closing ceremony, we have a trip in the boat in the Seine. So it's going to be wonderful, a very small group and very good friends. And on Saturday, our last cultural activity is to have a special visit in Garnier. I want to show to you some of the works of Hans von Leyden in this wonderful publication that he made in Spain, 70s. Welcome to the first seminar of the Collegium Medicorum Theatri. The Collegium Medicorum Theatri, or CoMeT, was founded in August 1969 during the IFOS International Congress in Mexico City by a small nucleus of prominent laryngologists with a special interest in the voice, the singer, of the actors. The founders of CoMeT intended to meet the need for an organization devoted to the vocal problems of the professional voice users, problems that have increased each decade with the demands and tempo of the 20th century. Just imagine now, 21st century with online concerts and so many new things. We are dedicated, says Hans von Leyden, to the scientific investigation of the highly specialized physiology and pathology, as well as to the improvement in the clinical care of singing and actors. I feel confident, he is speaking about Barcelona, that our dear Dr. Perello, also one of the founders of CoMeT, had the first seminar. And this is important, and I have to share with you that, because we need to focus on what is the meaning of CoMeT. So it's a result in closer friendship and cooperation between leading laryngologists in different parts of the world, and thereby contribute to the better care of our patients, the singers and actors, as they move from continent to continent, to city. At that time, there were no coronavirus, so yet now it's something else. In the pursuit of the artistic profession. In this spirit, I greet you on behalf of the Collegium Medicorum Theatri, fellows and guests from East and from the West, from the North and from the South. For medicine and the fine arts, no geographic or political boundaries. And of course, I invite you to our next academic session. We are going to celebrate. Please have a cake with you, that we are going to eat cake, because we have anniversary. It's birthday, 55th birthday of the foundation of the CoMeT. Do not miss. And we need to congratulate very dearly to the Union of European Phoniatricians President, Haldun August, to our dear Ilse Denisoglu, that has made so many efforts, many years, about this World Voice Day education, our dear John Rubin, and our very close friends Anna Danal, Danik Hatzibovic, and to all CoMeT members who are making possible this World Voice Day Marathon of April 20. And of course, in Mexico, for the Spanish speakers, I would like to invite you. We are going to have La Voz en Iberoamérica, and we are going to have some of our CoMeT members, Spanish speakers, in this celebration on Saturday 27. And I want to remind you also very interesting conjugated work from the British Laryngological Society and the Union of European Phoniatricians. This is going to be a joint meeting on May 25 in the wonderful Zagreb in Croatia. But also there is going to be a board examination from the Academy of European Phoniatricians in voice and swallowing, and they are going to be prepared by our dear friend Berit Schneider-Stickler and our dear Anna Danish. And of course, do not forget, please prepare your flight or prepare to swim to go to Spain. And then next year, please prepare, and I don't accept that you are not going to be with our great Bob Satalov and our dearest friend and the group of the Voice Foundation in 25. And also in 25, we are going to visit Prague with the Union of European Phoniatricians Congress. So my dear friends, I think we are all like, oh, so much information about that. So let's say thank you to all the assistants, and we shall have about only 20 minutes because I understand many of you have commitments and are tired because it's late. In Mexico, it's almost 1 o'clock, but all over the world it's not the same. But I want to thank you and also to motivate that I hope in the next face-to-face meeting in Madrid in 26, we can enjoy being together, because we know almost everybody here have organized CoMeT meetings. I think the most is us thinking with Richard Stesny, but I have organized in Mexico. Johan Sonder has organized in Sweden, and Mara Belau organized in Brazil, and of course Philippe de Jonquière organized in Groningen. So I think you have to leave some space and save the day for us, for CoMeT, because it's unique. And I want to thank especially our dear Austin, because he has supported a lot Erki Bianco in Paris with many administrative things. This is important to support everybody. And Erki has made a great effort in Paris, and many things of these administrative situations depend mainly on the opera, not really on our organization, from Erki as president and from CoMeT as a collegium. And of course, happy World Day for everybody, and we hope you have enjoyed this. It was a little bit like in a hurry, everything, but I thank you very much. And I would like to send a very special message to my dear, beloved friend, Wolfram Steiner, because he will be in a better shape now, and we send many dear greetings to him also, because he was not here and he usually stays with us until this time. So I would like to have a very special question. We have many questions from Bernardo, some questions from the audience, and I would like to ask Eleonora Bruni first, because we are going to begin on the other side. It's only one question per speaker. And Eleonora, we cannot see Eleonora, but we can hear her because she's on the way traveling, and that's not so easy. So Eleonora, in your experience with such a great high-level artist, do you think they can combine the habits of working properly the exercises with the medical treatment, or which is your experience? Please, Eleonora. Eleonora, are you there? Okay, so we keep on with the other questions. Sorry. Anyway, we shall invite Eleonora next time. For example, very important for Antoine is how much time after the injection the postoperative recording was done. Did the patient receive adjuvant voice therapy? This is a question for you, dear Antoine, from our dear friend Ray. But as you know, you can also, after Antoine answers, you can also have some short discussion. Yes, Antoine.
Thank you for your question. Recording was made approximately 2 months after the injection, but the results are even better after 6 months. We must understand that PRP injection is not like hyaluronic acid. It's a drug supposed to increase the production of fibroblasts. And as a drug, when the treatment is done, the results can improve by themselves after. And speech therapy is every time proposed. Injection of PRP are only proposed in case of failure of speech therapy. Speech therapy is proposed before all, as in all phonosurgery.
Oh, this is great. And how long did you wait before the decision of injecting? How long did you wait with voice therapy? 2 months, 3 months, or more, or longer?
I must say I am confident with the opinion of the speech therapist. Sometimes the speech therapist tell me that we must perform the surgery right now. Sometimes she thinks that can work a bit after. There is no simple answer to this question.
Thank you. And I wanted to ask you, Antoine, do you have some more experience with or knowledge about some other stem cells? Because we do know nowadays there are many movements about stem cells, not only in the vocal folds directly, but also in the body. And so the idea of many of the doctors that are giving in many ways stem cells is that the body is healthier and is younger. As in the Middle Ages, we were looking for that. Which is your comment about that?
We are currently doing a second trial on stem cells, but stem cells are a bit more difficult to obtain since you must harvest at least 100 and 200 cc of adipose tissue. It's not that easy. That can be a bit painful for the patient. When there is a very severe dysphonia, very severe scare on vocal folds, we include the patient in the trial. But when the dysphonia is less severe, like in presbyphonia, we prefer PRP. PRP is much more simple to perform. There is another trial currently working in the Mayo Clinic, I guess, about the stem cells in the vocal folds. At this time, there are two trials in the world, our and in the Mayo Clinic.
Yes, thank you very much. And Austin, there is a question for you, and also apropos this comment from Antoine. If you have some experience injecting hyaluronic acid, and I would like also to hear you comment about the stem cells, if you have some experience or heard something about that.
No experience with stem cells, but my injections as far as vocal fold atrophy is usually either hydroxyapatite or fat. And there is also a gel that we also use, which can be absorbed over the course of 3 to 4 months for temporary use as far as medialization of vocal folds.
Thank you. I don't know if somebody else want to talk about this very interesting topic, and I would like, Antoine, for August, I am organizing the program, and I would like you to have a little bit longer presentation of this issue, and of course talking about artistic voice situation, like in the paper that Yakubu Karagama presented us today. And changing subject, I would like to ask our dear Professor Johan Sonberg that he is here. Thank you very much, my dear Johan. I would like to hear your comment. What do you feel after 24 years, at least in Mexico, in some other countries they began later? How do you feel about World Voice Day celebrations? Because I remember very clearly that we were in Voice Foundation in a meeting, some persons, and we were talking about this necessity for the World Voice Day. Can you please tell us about your experience all these years with World Voice Day? You are, I don't hear you, Johan.
It's on my microphone, and then you may hear it, okay? It's obvious that the voice is a very, very important component in our life. and this is widely realized in the society. So voice is kind of a self-evident aspect of people, but they need to be helped to realize that it is important and it is worth to respect and to take care of and not misuse. And that is the main thing of the World Day, to help the general public to realize that, including funding bodies and politicians and other decision makers. And I think it is making a good job, that is making a better and better job for every year that is going on.
And tell me, Johan, your experience, because we used to have, at least I remember before pandemic, we used to have many face-to-face activities. Now we have also not only the face-to-face activities like concerts, lectures, performances, whatever, but we also have virtual. Which is your feeling about that? Because I think we have grown and grown and grown in so many years, and I thank you dearly for all your efforts. But tell me your comment about 2024 with so many digital and virtual sessions.
Yeah, I mean, technology is making a very fast advances and providing new means, and we could see in these meetings and symposia that it is that these means are being taken care of in the practical part of the voice, and that is very promising and quite a reason for an optimistic view for the future.
Thank you, dear. Thank you, Johan. And Austin, can you please tell us your experience in your area about these World Voice Day celebrations? How have the population or the medical doctors or the team group, how have they felt this great thing of having a World Voice Day celebration?
Yeah, the broader public that are being attracted to the 16th of April, when the World Day per se is being celebrated around the globe. That makes a good job, and it is a long-term job. It doesn't happen from one year to the other. And of course, the COVID was a drawback. Before the COVID, we had more than 700 events all around the globe happening on the World Voice Day to celebrate it. And then the COVID came, and then the celebration went down. But now we are on our way to get up again, and that is very important. And in more than 60 or 70 countries around the globe, there is a national coordinator that has the inspiration and task to encourage celebration, public events that for the celebration of the World Voice Day. And they are making a great job, and we are probably soon up to much more than 700 events around the globe.
Thank you, Johan. And Justin, what can you comment with us about this great celebration? Yes,
Eugenia, yeah, we found out that people are absolutely intrigued fiber optic laryngoscopy, where they actually watch people sing or speak. And so we try to get our TV studios locally to come in and to our voice lab, where they can actually get a film of the speaking and singing on fiber optic laryngoscopy, and that is, like I say, fascinating to most viewers.
And what do you think about the World Voice Day celebrations? Do you think the population have learned a little bit more, not only the performers, but also the general population?
Oh, yeah, I think that most people don't realize how sophisticated we are now in evaluating voice. And the problem is that most people don't value their voice till they begin to lose it. And so that's difficult sometimes to engage people that have never had vocal problems before. And that's an opportunity for us, I think.
Yeah, thank you. Some years ago, a scientist, physics scientist, asked me, how much statistics can I show that I am doing World Voice Day celebrations, many celebrations for the general population, not for medical doctors only, but for general population, because this is the main focus. Which statistic can I show looking for if this is worth or not? And well, I couldn't answer that. But of course, as you said, Austin, and as Johan explained us, and I am sure that everybody in this session has the same feeling that every day people know more about the voice and take care because of the social media. They say immediately when somebody lose their voices, when somebody sang terribly, or with some other politician that couldn't speak anymore. Sometimes they are happy, but sometimes not. So I think the population knows more and more about that. And I think all our efforts, tiny efforts or big efforts, I think they are worth for the focus of this education on the human voice, knowledge, and of course, care. And for example, Alan, in Estonia, are you also celebrating something special, Alan? In Tallinn?
Hello. So I think that celebrating World Voice Day every year is a good reason to speak about voice. For example, we just 2 days ago with Dr. Kristel Kalling, we gave interview to teachers. A newspaper which will be published soon, and we each year we have had a schooling seminar lasting the whole day mainly for doctors, but also for voice teachers and singers. And 16th, so one day before going to Paris, I'm going to help measuring voice range profiles. Oh, sorry, my voice. So the singers can get their voice range profile. So I'm sorry. So something happened to my vocal folds.
And I think in Tallinn is a cold weather, isn't it?
Today we had a lot of snow, but it melts away. And week ago we had plus 17, very warm. So it's a very strange April and very strange spring. I hope very much that it will be much warmer, the weather in Paris next week or starting from 17th.
Yes. I think this World Voice Day is really something very important. And I say to all the population here in Mexico, when I have the opportunity in television, radio, concerts, or whatever, I say, please shut your mouth and see what happens when you don't have voice. You cannot communicate, you cannot work, you cannot do anything. You feel completely unhappy. You feel that you don't have any value if you are a performer. You think that you are losing all your values when you are a teacher or a leader. And so it is a great effort that we are doing, and I think it's worth. And in CoMeT, especially because of our tradition in being a family and having these cultural and social activities with the scientific activities, we are doing also our small part in the World Voice Day. And of course, I want to ask Ilter, because Ilter has been very active in the Union of European Phoniatricians, organizing everybody, that sometimes we are late in sending all the information. But tell us, Ilter, about your experience as organizer in this World Voice Day Marathon. Ilter, are you there? Yes.
Oh, yes. So World Voice Day, the UEP, I am the World Voice Day coordinator of UEP, and we started with a short presentation form. But when we got many friends from all over the world in the last 3 decades almost, we needed to extend it. So it became a marathon, which starts in the American continent, and it ends at the Asian continent. So the World Voice Day will be celebrated with scientific speeches from all over the world when the sun goes up in US, and when the sun goes down in China. So I hope we are going to make it. Pray for us. So again, in Turkey also we are going to make the Voice Istanbul. Now it became an international event, and I'm so happy for this. So that's what I think.
Congratulations also for Voice Istanbul. I would like to cover the places, but sometimes if I swim 2 days constantly, I cannot reach Europe or Asia. I'm sorry.
Okay.
But anyway, I would like also to ask our dear friends Iris and Soledad, because Ana Gloria has already left, because Argentina in South America has also been very active in the World Voice Day celebrations. And this year, I am organizing Iberoamerica. That means all these Spanish speakers, friends of CoMeT, and CoMeT is a family, so we belong to each other. Yes, Iris, if you want to say something about World Voice Day celebrations in Argentina. You're on mute, my dear.
Hi, everyone. Congratulations. First of all, congratulations, Eugenia, because you are great meeting us in this kind of events. I like to congratulate you. And in Argentina, we start celebrating the World Voice Days from the very beginning, when Brazil invited us to celebrate together. It was in 2012, I think, and we was with them very quick, and from that on, we celebrate every year, and we found that the people get more and more involved in this year. So we are very pleased to celebrate and to have the mentor of the World Voice Days, that was a doctor from Brazil, let me
Mario from Portugal.
Mario from Portugal. First of all, was our Brazilian doctor, Nidio Stefan. It was the first idea in Brazil, and after that, Mario Andrea spread the idea for around the world. So Argentina was very close to them, and we continue doing this job, and that is very wonderful. And thank you, Dr. Sandberg, because Dr. Sandberg met us in a globalization way, you know. So that's a very, very important.
Thank you for your kind words, and I agree. Well, as you know, Johann Sundberg is a honorary member of Collegium Medicorum Theatri. We love you, Johann, and we need.
And let me, Eugenia, let me say something about our dear teacher, Dr. Susanna Naidich. I would like to remember her because she passed away last year, and she was a very, very good partner with us to work in a World Voice Days. And Soledad and Susana and myself work together very, very, very much in Argentina.
Congratulations, and I know when I heard this idea from our friends in this meeting, it was also Bob Satalov there, and Ron Scherer, and Mara, and Johan, I don't remember who else. Yeah, Paolo Pontes, I think was also there. So I thought it was a great idea. And so I came to Mexico, and even though there are some political issues that are not combining very well with spread the knowledge, because the knowledge is universal, we began to do that. And then Johan organized us very, very good, and then we began to be national coordinators, and then we grew and grew and grew, and I think this is a great job. And now the Voice Foundation with Bob Satalov and with the sponsoring of the World Voice Day page, first was from Johann Sundberg, the sponsoring, and I thank you for all those years, Johan, to the Royal Institute that sponsored that, if I am not wrong, and now it's the Voice Foundation, and of course, I think we have to collaborate and donate what we can. If we cannot donate money because of whatever situation, we can donate ourselves with presentations. And I think all the efforts also from Jan, because Jan, as the new manager of the Voice Foundation, has made a great job also. So everybody here in this group and almost all CoMeT members have celebrated this World Voice Day. And well, this humble celebration of today is to acknowledge all the members like Johan, like Austin, like you, Iris, with your group, Soledad, and Ilter, and so many that I cannot name that, from CoMeT side to acknowledge all the efforts for this day, because the world needs that. We do not need division politically or because of power egos that some human beings have, but we need to be close together and to have a focus on human voice communication and human voice artistry. And I don't know, Soledad, if you want to add something?
Happy to celebrate with professionals I admire so much. Thank you. Wonderful celebration, Eugenia. Thank you.
And let me, Eugenia, let me add something. There is a paper, an article, published, I don't know, I think 5 years ago, or more, or a little bit more, and the paper was wrote by Marabella and Jan Sveck, and they both tell us the very beginning of the celebration, and I recommend to all of us to read this article because they offer the complete information about the World Voice Days there.
This is great, and I have to say that this article I can send
to everybody. I cannot publish that because I need to ask Folia Poniatica if they allowed us. So there are two very important papers, Austin, for CoMeT. One is the greetings, the welcome from Hans von Lesen in the 70s, and the other one is Jans Beck and Marabelau paper for the foundation of the World Voice Day and all the explanation. And please do not forget, I am working very hard, not me, but the technicians, because we have the opportunity, as I told you before, to publish in YouTube the presentation of Singing and Science from Jürgen Wendler. It is great because we see many of our dear colleagues singing, some mentioning like Johann, and some are singing like Wolfgang Steiner, Pereke, Søren Seix, and many others. Fritzl was also singing, and Lindholm. Johann is also singing in this presentation, but unfortunately, technically is not yet ready. But when it is ready, please spread that, because it's a wonderful presentation about singing and science. Is a question. So I thank you very much. I don't know if somebody wants to add something, or everybody is very tired.
I would like to compliment Eugene about inspiring and inspired work with this CoMeT and its role in the celebration of the World Voice Day. Thank you very much, Eugenia. It has been fantastic.
Thank you, my dear. Thank you. So I thank you. Don't forget, CoMeT, we are all. So we have to work for CoMeT. Artistic voice is important. And as Austin says, CoMeT is unique. I love you all.
Bye-bye. Bye-bye. See you. Happy World Voice Day.
Happy World. We are not going to say day anymore. Month. I am going to talk about singers, about politicians, about teachers, and how to breathe properly. I shall send you all the invitations. Thank you.
Bye.
See you in Paris, my dear Alan. Ilse, I see you in Paris. Bye-bye.